Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community, discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Welcome, everybody. This is Kwadwo Kyeremanteng representing Solving Healthcare, Podcast of Champions. And we're bringing back, I'm pretty sure, the most requested guest. I don't know, maybe just like most requested or like at least made the most appearance.
Most appearance for sure, yeah.
Amazing. So we got Dr. Chakrabarti, and this is a man that bears no introduction. Infectious disease doc, friend, I'll say colleague, and we're excited to talk about a few things today. So number one, you missed our mega show with Zane, with Stefan and Monica. Can you explain to everybody what happened?
Yeah, so I had a kid. She was born on the 21st. So I think, when was the show? It was the 23rd, right?
Yeah.
And I was going to do it, but then I just thought to myself, we got the first two kids in bed. It probably wasn't a good idea, but it actually, everything went well. The transition hasn't been too bad. I have 3 girls now, so it's certainly a new frontier. We're getting used to it, but it wasn't in the cards that night.
Well, congratulations, and you know what? We're just happy that everything worked out, and you got a lovely, healthy family. Everyone's doing good. So you know what? I want to start with what really has been driving discussions lately, and we'll get to talking about exit strategy because I know you were pretty passionate about wanting to say some business about that. But let's talk about essentially the lockdowns that we're in right now. You and I have been pretty vocal about not wanting to see this, and trying to avoid this being 20 plus months into the pandemic and the devastating impacts. But like, maybe just start like how you felt when you heard that announcement on Monday.
I was, really, really surprised and frustrated and, gobsmacked, if you will, seeing that. It's just that I thought, especially with the way when Dr. Moore was talking to us back in, I think it was around September, October, that, look, we want to keep things in check without causing any disruptive lockdowns. I figured that we had seen the last of it. I get it. Omicron was a surprise. But we're 2 years into this thing. We've learned a thing or two. We have way more tools under our belt. We have 90% close to eligible people on the ground vaccinated. What are we doing? Why does this feel like we're back in March 2020 again? Which, by the way, if you ask a lot of people on the street, that's what it feels like, right? And that's how I felt. And at that time, I'll be honest with you. And I told you, Kwadwo, that I just felt like, why am I doing any of this? I've been speaking my mind to the best of my ability in good faith. And in the end, they end up doing something that has really no scientific basis to it in my mind. And it was very upsetting. And plus, I have a kid in school now. She's 4 years old in JK. I know it's not, physics 101, but, having her there, and just seeing how awful it is to have the kids, I shouldn't say awful, I should say difficult to have the kids not face to face. It hit much more close to home for me this time.
I can imagine, like, being the first time having your kids go through school. And I got to echo this too, man, like the emotions of like that roller coaster, when we heard that announcement by Dr. Moore, like I was telling people, I think it was New Year's Eve, right? I was telling people, this is a celebration, people. You don't understand what this means. We're exiting this bad boy. We're having a realistic expectations. We're having a pivot, if you will. And it was a celebration. And this complete 180 on Monday. And I got to say, I got a little bit of heat for that, but I went on Twitter and I went off a little bit, and I apologize if I upset some, but that was raw emotion when you're thinking about how it's going to impact your family and all those that are underserviced. And what would you have liked to see? Like, let's be honest. And we're in a situation where there's mounting cases, there's a hospital strain now. You know what I mean? Cases are rising, hospitalizations are rising as well. What would you have liked to see in terms of a reaction?
It's obviously easy for me to talk in retrospect and also as somebody who's not making the decision. But I think that looking at what's happening right now, I think that there's this sense that we have a lot more control over this than we actually do. Think about this right now. Whatever we're seeing as the case count, the highest we ever got to was 18,000 a day. And more likely that was 35. Zain Chagla was estimating 40,000 cases a day. If you have a wave coming at you where you're seeing 40,000 cases a day, me closing down, Boston Pizza, me telling people to not hang with their family for a couple of nights is not going to make a difference. Right. This is happening. This is what happens during the winter months. They did do some, I think, reasonable restrictions with the largest gatherings, like the huge ones. Okay, I can understand that. And I just wish they had kept it where it was. Right. You're going to see, I mentioned this a lot recently, and we don't hear this a lot kind of broadly spoken, but after Christmas, after New Year's, contacts naturally precipitously drop. Right? People just aren't getting together with their families. So that makes a huge difference up front. That's one thing that makes a population-wide difference, in my opinion. So I wish they had just held on. And it's going to get ugly for a little bit. I don't think it's going to get as ugly as the third wave did, but it's going to get tough, right? Especially with our staff shortages. We're kind of seeing that and waiting. And then when things get better, and not constantly thinking that when things get bad, you need to restrict and lock down. That knee-jerk reaction, that association that many people have is what I think upsets me, and I think this could have been avoided.
I mean, you bring up really good points. Like, one, I've been saying this too, like the cat's out of the bag. You know what I'm saying? Like, we truly, when you decide to add these restrictions and you're talking, as you said, I think the 40,000 a day is a very fair assessment of what's going on in Ontario, if not higher. And then you have the natural reduction in contacts over Christmas or past New Year's. Realistically, I personally have a similar feeling, like if are those restrictions going to actually make a difference? And I've been also saying a lot, Sumon, I'd like to see more interventions done. I don't know how you feel about our overall booster approach, for example.
The booster approach, I have to be honest with you, with Omicron or not, so even before Omicron came, I think that it made sense to me that people that are over the age of 60, that's where we were seeing initial early evidence that there was a reduction in the risk, the decrease in the reduction. Let me start again. A decrease in the protection against severe disease.
Right.
Okay, that we saw that. But we haven't seen that in younger age groups. So for me, it makes sense that you get that age group, you get people who are immune suppressed, get them that third dose. To me, that makes sense, not just because of COVID, but just what we know about vaccines and how they work, especially in immunosenescence and in immune compromise. I think this push to do a population-wide booster didn't make a lot of sense to me. I think that it set up a situation where you had like 18-year-olds going to a lineup in the dead of winter, and people who needed it not being able to get the shot as easily, right? And if you look at what Omicron did, there were some in vitro studies that showed that you might be able to get some neutralizing antibodies, but we know that these things wane with time as well. And Omicron is immune evasive, and the very antibodies you're boosting are the ones that it can avoid. Right. So I just didn't think that the booster, this widespread booster, could make a difference. And I'll say one other thing that I think has been lost in the conversation is that a vaccination, especially one like the COVID vaccination, is an awesome vaccine. It works really well. But this is an inflammatory vaccine. It's very immune stimulating. And doing that over and over again can cause problems. And and we've seen some evidence that there is excess myocarditis in young men doing that. So I just think we have to be careful about just doing these things on conjecture. I get it for the older age groups. I get it for immune compromised, but a population-wide thing with no data, I think that it wasn't going to work. And now we're seeing around the world the results showing that it didn't really have much of a benefit against Omicron.
Yeah, I mean, this is where I also felt pretty strongly. Like I worried. So one, strictly approaching this from a data driven approach. Once you get to the younger demographics, are you seeing any impact on severe disease? And we weren't. And then my worry was, and I use this anecdote, like I ran into a guy in his 70s. He's like, I can't get a bloody booster. And he had a little bit of truncal obesity too. And I'm like, this is messed. If we can't get this guy a booster and, Kieran or like little Jimmy, 22-year-old is getting his third dose, like this is not part of the solution. Because I would say you look at who's at risk of landing in our hospital, and it's not our 22-year-old kids. It's the 70-year-olds that have that are comorbid. I just feel like we need to be more targeted often. We know who's at risk, and I don't know if you feel the same way, but do you think people know who's at risk of being hospitalized? Do you think people know their own personal risk?
I think that with the messaging that we've heard, the answer is probably no in general. I think that you talk to people, especially those who are very fearful of getting COVID, they don't realize the risk. I think that one thing I will say is when you look at the messaging, people are, when we talk about the effect of the vaccine, there's a mix up between the protection against severe disease and the protection against infection. So I think in general, people know that the vaccine is awesome to this day. I got vaccinated over a year ago now with my first dose. To this day, my protection against severe disease is still there, right? Maybe it's gone down a little bit, but it's still there. But the thing is that we keep talking about the protection against infection. And I don't think that's been well communicated. So if somebody's listening here for the first time, what I mean by that is protection against infection is if I get exposed to COVID, I may not have a positive test and I get no symptoms, right? Whereas what I worry about or what I want is something that's protecting me against severe illness. So if I get exposed to COVID now, I don't care if I get a fever and I'm in bed for a couple of days, or, I feel like garbage, or I get a stuffy nose. But the fact that it's keeping me out of hospitals, I think what is the main thing for me. And that idea, I don't think has been well stated in the communication. And, when you're looking at what the booster does, well, the booster I think can help somebody who's 60 years old, but you're just basically boosting antibodies for somebody under that age. Let's say a healthy 40-year-old, you're boosting antibodies that are already there in your memory response, and you're not really adding anything in terms of protection against severe disease, which as it is low in somebody who's under the age of 50 or 60.
Yeah, and you bring up the point which I'm a little bit anti with. You're getting a lot of talk about even 17-year-olds getting boosted. And and you brought this up about the, the inflammation, pro-inflammatory response, 17-year-old getting the third shot, especially if it's mandated, there is that risk of myocarditis. I haven't seen the third dose. I haven't seen a study on third doses on 17-year-olds yet. And maybe there is one. I don't know if there is, but we already seen some pretty concerning myocarditis signals with our youth, our male youth, especially. And so this is where I think let's be data driven. Let's think about this a little bit. Let's not create more problems than we need to, and ask and really focus our attention on those that are at risk of being hospitalized, especially we gotta also think about transmission at this stage, with Omicron. What's your feel about, reducing transmission based on booster status or second dose? What's your feel?
Yeah, that was another point, is that I think for me, one thing that has been disappointing about the vaccine, and again, I'm being crystal clear here, this vaccine is awesome.
Magical.
I got it. Magical. It's keeping so many people out of hospital. It's really changed things. But yeah, the protection against transmission has been disappointing. I think that for those of us, you've heard the term waning immunity, and that's more not for your protection against severe disease, but when your antibodies drop, we do clinically see that your risk of getting symptoms if you're exposed to COVID gets higher when you are further out. And the other thing is there still is protection against transmission, but it's not as good, 3 to 4 months out. And there's multiple places now showing that after the booster, you initially get that increase in antibodies, but they wane again. And that protection against transmission is really not that great. Mm-hmm. So I think that with keeping that in mind, and keeping in mind how quickly Omicron can transmit, we really have to pivot here, because I think that, if I get my booster today, for a couple of weeks, I might be transmitting a bit less, but it's a drop in an ocean compared to this huge wave that's come at us, which will end soon. But I just think that we have to be realistic.
And what's your general vibe with Omicron? You were seeing all this data saying, less virulent, more transmissible. I think we're in agreement with that. But what are you seeing in terms of how it's affecting hospitalizations? Are you anxious about the denominator phenomenon, where we're saying that if you infect so many people, even if it's less severe, it really it still could put a significant strain on your healthcare system? What's your feel?
Yeah, I think that everything you said there is important to consider. So first of all, there's no doubt Omicron is milder, right? When you look at the entirety of what we're seeing, is that the clinical course is different. It's certainly different than Alpha and Delta, and that is awesome. But yes, at the same time, these two things can be true. I'm not I've been accused of being a denialist. No, the other thing we have to consider is that there's such a rapid expansion in cases all at the same time. So even if you see a small proportion of those are mild, a bit more severe enough to hospitalize you, that can be a lot of hospitalizations. We certainly are seeing that. But clinically, and Kwadwo, I'll ask what you're seeing in Ottawa, but on our side, and I think that people are seeing this around the world, is that when people are coming to hospital, we're seeing a lot less of that classic COVID pneumonia, where people get the bilateral infiltrates, hypoxia, needing oxygen, people needing to be put on the ventilator. We're seeing a little bit of that, but it's mainly Delta. What we're seeing more is kind of older, more fragile individuals who have chronic health conditions, which then the Omicron has destabilized. So I'll give you an example. In an 80-year-old guy with diabetes, kidney failure, might be in a nursing home, he gets a fever from Omicron and then becomes dehydrated and starts falling or gets really confused. It's a common scenario in hospital even before Omicron, but you see this, and that can really, really expand quickly, right? Because a fever in a nursing home patient, even if it's mild, can be enough to put them over the edge. So we aren't seeing as many people put on ventilators or even high dose nasal oxygen, Airvo for Kwadwo, but hypoxia, right? So we're not seeing that, maybe a little bit, but if we are seeing that, it's in somebody who's unvaccinated. But the point being is that the overall picture is milder, there's just a lot more people.
Yeah, that's exactly what we're seeing. Like the volume is up, and it's tough to, we're getting these like not classic symptoms, like not as much people requiring high levels of oxygen. Like when we talk to our respiratory therapists, relatively speaking, they're not following that many COVID patients compared to previous waves. And in the ICU, it's the unvaccinated are the main numbers. Like we're only still around 9 or 10 in Ottawa. But the ones that are like really sick or unvaccinated, there's also some of the question of whether that's Delta or Omicron. Like I haven't seen that data yet, like in terms of their phenotypes. And then a couple others are like cancer patients, like that have been triple vaxxed, but like obviously have poor immune response. Yeah. And then a few incidentals, like clear incidentals. Good point. Yeah, this is the one thing that I think is good and more of a challenge for the ward patients, I think. But clearly there's going to be a high number of patients that swap positive for sure because of how much is in the community. And just to reinforce the strain on the hospital issue, like a lot of this, yes, there's a lot of Omicron people coming through. And what that means is they need isolation rooms. We need all the COVID precautions, N95, all the gamut. But there also means that there's a lot of staff, because there's so much in the community, can't come to work. And so like, this is really a compounder. And I don't know how you feel about this, Sumon, but I do at my personal level, I think we do need to pivot a bit in terms of our IPAC practices, like in terms of, so IPAC is infection prevention. I don't know what the AC is.
And control.
And control. Okay, good. On the spot, it was like, And because like, so just for everybody else, like classically, you would need to be isolated for, 10, or actually it was more than 10 days back in the day, I think. Staff needed to 14 days initially. 14 days, staff 14 days. And so now we're the community, you have to isolate for 5 days, but we're still having a bit of a longer or more classic isolation and quarantine measures. Do you have any thoughts on like if we should be pivoting at all in regards to that?
So first of all, it's really important for us to remember that IPAC is like one of the most important things that we have in the hospital to help prevent infections. And they do such good work. I worked with them for a year in the first year of the pandemic, and I learned so much. So it's important. What Omicron is basically a bull in a china shop, right? And a lot of the quarantine protocols that we're using, some of it is all the way back from what China was using in February 2020. And it's changed a little bit. It used to be 14 days for a close contact and 14 days if you had COVID. The latter changed to 10 days. But even that was deemed to be too long, especially with the variants. But we haven't really put that into policy. You saw the CDC mention about the 5 days. And we haven't really, to my knowledge, we haven't exactly changed to that yet. But even now, I'm wondering, like the sheer amount of COVID in the community, at some point we may have to pivot to just not even testing people who are asymptomatic. Understanding there's going to be some transmission, but look, if you have an entire staff off, right? Think about this: if you have an entire, a neurosurgery program off, and somebody comes with a brain bleed, that's way worse, right? Mm-hmm. Because you can't treat it. So I think that's why, at least for the next couple of weeks, when we're kind of entering like the eye of the storm right now, and then it's going to come down, but we might have to pivot. Otherwise, we won't have the ability to look after very sick patients or patients at all. Yeah,
and I think we need that guidance before the storm really hits, if I'm being honest. Like, I think I worry that if we're too reactive, that it could get sloppy. But it's just something to think about. And I'm not going to pretend to know the answer. It's not my wheelhouse, but it's just an important question to ask if we do need to think about our approach. Are we going to test everybody, even if they're asymptomatic, and knowing that there is a risk of causing more spread, but there are at times going to be things that are worse than COVID, as you said. If you need a emergency surgery, if you have really bad infection. Like we gotta think this through. But in my mind, it's important to be proactive about this. So one thing we kind of touched on schools, like, the fact that, they're closed. And I've never asked you this question, and you could avoid it if you feel like it. But I get this a lot, like where people are like, we can't go to school unless we like, until we have the safety measures put into place and so forth. Without leading you, like, do you feel schools are unsafe?
No, I mean, I think that we have to kind of figure out what the goal is. And, for the longest time, our goal was to try to stop all transmission, or at least the bulk of transmission. That's not the goal anymore. We have to remember that everybody has now had a chance to get fully vaccinated. The vast majority of people that are going to be in a school are not going to be high-risk individuals. There are high-risk individuals, but again, vaccine is there to provide protection against severe disease. And, before Omicron, yeah, of course, we saw school transmissions, but it wasn't this raging fire that we were seeing, for example, in the manufacturing sector in the Peel region, right? Mm-hmm. Or, large households with the introduction of a COVID case. It wasn't like that. And I think that I very much applaud doing things that we can to improve things like air quality. I get it. I love that. I love the idea of, having like a protocol set if people to identify people or, what to do if you start to have symptoms. But just like anything in this world, there's trade-offs, right? And from what I understand is I think us and some parts of California are two of the jurisdictions that have had the longest amount of time for kids being out of school. And I think that the impact of this right now is immeasurable. We're going to see that only in the next couple of years. My kids are young, but my oldest one is now in junior kindergarten. So it's not, physics 101, but she's there. She's in school. And this is such an important aspect of their development. There's all sorts of good things about school from many different spheres. And not having kids in school, the impact of that is way more negative than the possibility of COVID transmission. And again, listen, I don't have all the answers, but I just think that when I do the trade-off in the risk-benefit ratio in my head, for me, it weighs heavily on the side of being in school, the kids being in-person school.
100%. We don't need to talk about how much a devastating impact it is on their mental health, the physical, obesity, the mental health disorder clinic, like admissions, like eating disorders, general anxiety, depression. And the thing for me, it's like often generational, these things that, when you really damage these kids, it could impact how they treat their kids. Like, I just think the short-sightedness of all of this is killing me. And then in terms of like the safety of school, I always come back to the idea of like, what's the data to say that it's not safe? And I'm with you. If we could improve air quality and all these things, like prevent kids probably avoid less absenteeism, less cold and flus and everything, less COVID. But my question is like, is it truly a problem now? And the thing that I always say too, because like they're always talking about N95s and all this stuff in class. Like, you got to realize, people, Sumon and I will be in a person's like pre all this N95 movement. Sumon and I would be in somebody's COVID room, or nurse. Better yet, a nurse would be wearing eye protection, a surgical mask, and a gown, and this patient could be coughing like crazy. And you're putting your stethoscope on their chest and they're breathing on you, wet and all this stuff. And we weren't getting COVID. We were protecting ourselves. So to tell me that now, now we need more and more, like, I know we're dealing with Omicron, and, I haven't seen any data to say that we need N95s for this, but like, I really do think we got to ask ourselves, is that safety question really, is there any data to support that schools aren't safe?
Yeah, and listen, I'll tell you the other thing is that we have to also remember it's not just what like the transmission; it's also who's there, right? So if you look at transmission in a nursing home, right? Transmission in a nursing home can be very unsafe because the people who are in a nursing home are very medically fragile, and especially if they're not vaccinated, you can get really sick and die, right? And that's what we saw in the first wave; it was awful. But in a school, like the overall risk profile is very different, right? And I think that if you're looking at it for the prevention of every single transmission, you're never going to get there. But I think that for the most part, in terms of what we're doing to protect the teachers and the students, I think that it's not 100%, but it works. I will say Omicron is different. Yeah. Omicron is certainly different. But that said, I think in the school, we saw, I don't know if you read about that issue happening in New York right now. So there was a big school in New York where there's all these teachers off. So they were actually sending big cohorts of students into the auditorium because there's no one to supervise them. Yeah, but that wasn't because the teacher was sick in the hospital dying. It's because of the quarantine rules, right? And this is where I think that we really have to pivot. And at some point, we're in a transitional period right now, but at some point, when you're in the community, and if you, let's say 2025, if you have the sniffles and you have a fever and cough, you don't go and get tested. You just stay home and then you go back to work or school when you feel better. You're not going to know what it was. Right. And that's how we've always done things. And all of these viruses have the same symptoms. And at that point in time, with people, vaccinated against COVID, it's just going to be one of these circulating respiratory viruses. And you don't need to test yourself in the community. You won't even know what it is.
Yeah, no, exactly. Like, and this actually pivots to a last topic. And we kind of touched on a lot of things here, but exit strategy, how we get out of this bad boy. You know what I'm saying? This is those that just joined, Sumon had to miss our exit strategy episode because of the birth of his lovely new daughter, third daughter. And I know you were excited about this episode. So, like, how do we exit this thing? Because I'll just say one thing. It is clear to me that whatever we're doing right now is not a sustainable strategy. And I think if anybody doesn't see it, I don't know what to tell you. Like, we have a lot of these people that come, hey, we need to do more restrictions. And I've been keep pushing and saying, but when do they stop? What do we do to get out of this? Because this is not a long-term solution. So Dr. Chakrabarti, how do we exit this bad boy?
This is really, really important because I think that right now we've clearly entered some type of new stage, and especially with Omicron, this massively transmissible virus that is hitting everybody, right? There's going to be, after it washes over us, there's going to be a significant amount of acquired immunity in the community. And that's going to have an effect, right? Because this type of immunity, whether you're vaccinated or unvaccinated, it's going to do something for the population, right? In changing our immunologic profile on the ground. So I think that if you kind of look at the end of a pandemic, pandemics don't just end like that, right? But the one problem in this current pandemic is that we have a lot of metrics. We have dashboards, we have news stations telling us what the daily count is. Even though we all know that the daily count doesn't mean anything anymore, you all look at it. I'm guilty of it. I just want that stupid thing to come down, right? Even though I know it's not accurate anymore, we all do it. But the thing is, that psychological aspect of it is very important because I think that that's what kind of has fueled this. COVID's not going to go away. It's going to be with us in the background. It's going to have spikes in respiratory virus season. But the thing is that so does influenza, it can be very serious for old people, for children. There's other viruses, RSV, which can be deadly for younger kids, rhinovirus, parainfluenza. We don't look at the case counts of these every day, every year. We don't base our risk assessment. Oh no, the COVID case count is 600 today. I'm not going to go and see my friend at a restaurant today. That's how people are thinking. So part of this is going to be kind of weaning ourselves off of these data metrics. And I think that Omicron was a bit of a gift that way, is that the test, trace, isolate thing and keeping tabs on every case in the community is broken. You can't do it. right? Although I'm still surprised we got 11,000 positive tests today, even with the targeted testing. Just shows you how much is out there, right? But the point I'm making is that once that metric becomes less important, right, this is not going to be the forefront focus on everybody's life. And everybody's going to have a process. And for those of you listening out there, I know that everybody is in a different place. Some people are like already, having indoor hugging karaoke parties. Fine. Other people haven't seen anybody and they're in their basement. Okay. We're all going to have a different process. But the point is that to start the process, it has to be an idea of changing our perspective. And that's going to be getting COVID out of our windshield and getting it into our rear view mirror. And I think that we can do that safely now because we have vaccination on the ground, because we have a lot more knowledge. We have therapeutics, right? And I think the idea that we're not going to get rid of it, but as we can live with this safely, we just have to change our perspective. And I know this sounds funny, but testing and case counts and all that, the metrics, that's going to be the first thing that has to kind of come down and come away from our consciousness to be able to move forward.
Yeah, I couldn't agree more. And I think we need to, in my opinion, we got our vaccines. We have a therapeutics, as you mentioned, which I think are underappreciated, whether it's monoclonal antibodies. I looked at that fluvoxamine study again, and I'm like, I'm not sure why this is not more widespread. For those that don't know, it's antidepressant shown to reduce severe disease. I think this is where we just need to be, once again, thinking outside the box and focus on interventions and rely on our vaccines, and then have that kind of change of mindset where it's not all about the case count dictating things, especially when we have a less virulent, and to be honest with you, if it behaves like it quote unquote should, future variants hopefully are less virulent as well, maybe more contagious but less virulent. Because once again, I really hope we could start to having this dialogue. And maybe one last thing I want to pick your brain about too is how we could create that dialogue though. I don't know about you. Every once in a while, you have a bad Twitter week or social media week, and I got drop kicked in the bad couple months. I got drop kicked in the pelvis, and basically, I just to me, we got to be above this. If we're 20 months into this and we can't have better solutions, there's something wrong here. So I just hope that we could, I'm not sure what the solution is, but I would love to try and find more common ground with maybe people that we're not seeing eye to eye with.
Well, actually, I think part of that, Kwadwo, is the fact that we just haven't seen each other for, I'm talking about in general, right? We haven't seen each other. There's tons of people that I have disagreements with, but, when you see them in person and they go, oh yeah, I remember, Paul, he's a great guy, right? And even though I don't agree with him on this, you can talk about that. I think that's important. And, I think that, I'm not a policymaker. I'm certainly not. But I think going forward, one of the things that we saw here in the pandemic is that it kind of just highlighted the weakness of, our healthcare system in many ways is good, but this is one of the weaknesses. And it really kind of highlighted that. And I think short-term and long-term strategies are needed so that when we see another pandemic, or even if we see another spike
or cases, of new variants,
or something happens, it's not constantly. I will say that restrictions and community restrictions have been used in the past. It's not that they've never been used, but it's not something that's been used to this extent for this long in history, right? And the thing that troubles me is that you see it on Twitter, you see it in your friends that, we're enjoying ourselves, we're outside, and that means that the cases are going to go up, we're going to have to restrict. And I think that's something that I really hope we move away from, is just because, there's going to be respiratory viruses. we're going to see more sickness in hospital, but we don't constantly have to have that cloud of lockdown and restrictions hanging over us, because I think that in itself has been very difficult for the perceptions and psyche of everybody in the public, because we shouldn't feel guilty going to a baseball game unless you're a Leafs fan. Then you should feel guilty. But I'm a Habs fan in Toronto, so it's been trouble. But you shouldn't feel guilty. If I want to go out to a bar and have a burger, I shouldn't feel guilty about that. This is what we do. We do this thing together, and I think that we need to get back to that and kind of examine our humanity again and our connections, because I think there's going to be a lot of healing that happens in the next couple of years.
I couldn't agree more, my friend. Like there's going to be a lot of healing when I hear stories of I haven't hugged my grandparents that haven't hugged their grandchildren in 2 years, and that heightened anxiety. And this is where I thought also the risk assessment was vital, because people thinking that they're going to kill grandma just by getting double or triple vax, and they're double or triple vax, and that's a heavy weight on people's shoulders, and like we need to step away from that. We need to really go back to being connected again, and especially with this, in my opinion, this mental health crisis that's going to be coming or knocking on the door over the next years.
You want to know something crazy that my dad said to me the other day? My dad's over 80, right? And he said to me, and it has a bit more of a poetic feel to it when it's in Bengali. That's what I speak. But he told me that, like, look, I know that I'm at higher risk. I'm fully vaccinated, but I would rather be put at risk of getting COVID and dying if I hugged my kids, rather than not hug you again for, there's a point where I hadn't seen him in over a year, right? And that's another thing. Yes, we do want to protect our elderly friends and relatives, but they're people too. They can make their own decisions. And many people are just like, you know what? I just can't do this again. I would rather get COVID and die than, if I'm at a get together with my family, then have to be away from them again. And I think that I hope we never go down this path again of, separating ourselves from each other, because that's kind of who we are as people.
That's what it is to be human, my friend. And it's just sad to hear that too. Like to think that you have to make a decision like that. And you know what I mean? But Sumon, as usual, my friend, I want to thank you for agreeing to come on, doing the live show, live quadcast, Solving Healthcare. It's just nice to be able to have a discussion, a nuanced one, where you could share ideas and different perspectives, and focused on like moving forward, not just whining and complaining, but like, hey, what can we do to get through this? And I want the listeners to kind of continuously have that tone of not just being apathetic to what's happening, but constantly asking ourselves, how do we get through this? Because a lot of you have stepped up. A lot of you is like, with time to get vaccinated, I'm going to get vaccinated. You were needing to stay home, the first wave and all the other ways, you stayed home. You did your part. But now I think it's time to ask for more. I really do think it's time to ask for more and say, like, we've done everything you've asked for us. Decision makers, how do we get through now? How do we get to the finish line? And Sumon, once again, you're part of that conversation, and the bravery and the putting yourself out there. I got to just commend it. So I just thanks so much for doing this.
You too. But yeah, it's great talking to you. And I think now we talk about this a lot. I'm pretty good in the lead, even over Isaac and Zane, and for appearances on your show.
Yeah, so, Isaac has been like a long time. I think he's retired, but like, yeah, you are by far number one on the Quadcast, and I think you'll always be. Yeah, absolutely. And one time we're doing this show live, or like with each other, like face to face. It's always better that way.
Oh, totally.
All right, thanks everybody for listening. Those on Twitter, this was our first time doing it, so I apologize if it came across with awkward audio. Facebook, we do this right. Follow us on Facebook, Instagram, YouTube, and now on YouTube at Quadcast, and leave any comments at quadcast99@gmail.com. Follow us anywhere. We have our shows on iTunes, Spotify, wherever you listen to podcasts, and we love you. Thanks so much for listening, my friends.